Hey. So today we are going to talk about ab repair. Now, this is something, again, you guys have no idea what the heck you're talking about when you talk to me. There is a difference between an ab repair, a tummy tuck, and a mommy makeover. Mommy makeover, I'll do a video on. It can literally mean one of 4 surgeries or all 4 surgeries. It's tummy tuck, lipo, breast aug, it's breast aug, tummy tuck, it's breast aug, tummy tuck, BBL, lipo. We're not even going to get into that today. Just because you say mommy makeover does not mean that that's like a general name for a surgery. It's a couple different things. So today we're talking about ab repairs. First thing I want to explain to you. An ab repair is not guaranteed with a tummy tuck. Just because you're getting a tummy tuck does not mean you're having an ab repair. A tummy tuck is a removal of skin. So it's removing excess skin. It's tucking the skin on your tummy. A mini tummy tuck is where they just do the lower half because you don't have a full abdomen worth of skin. Just because you're getting a tummy tuck does not mean you're getting an internal ab repair. What is an internal ab repair? So your abs, let me see if I can get a picture here. You guys listening on the Spotify, I know that you cannot see anything. I would suggest joining us on YouTube so you can see what I'm talking about. As I'm showing you guys pictures, I am whipping out the plastic surgery recovery textbook. Okay, so let's take a look at this. These are your abs, right? So with your abs, you have this line down the middle. That's called the linea alba. That is a line of fascia. Fascia is connective tissue that holds your abs together, right? So when you have a massive amount of weight, that will stretch the linea alba and separate your abs, which then causes your organs to come spilling through. When you have a baby and it pushes against your stomach and your stomach stretches, those abs separate. That linea alba tears or stretches so much and becomes so thin that your organs and soft tissue and everything starts protruding out. So if you've ever seen like someone with an upper pouch, like the top of their stomach is sticking out, not so much the bottom where they have like a pouch of fat that they can pinch, but it's really hard. And they've got what's called a distension or diastasis recti. So that's basically where this whole area poofs out like this and it looks like it's sticking out just here, the whole thing. A lot of guys have it. You'll see a lot of guys with like a beer belly where it's hard. That's the ab separation. Mommies get it after the baby. And once you have the baby and the baby is out of you, you then start to notice it looks like that like weight that you can't get off, but it's your upper stomach, not your lower stomach. It's not flat anymore. That is a separation. Now, with that being said, a hernia repair is different than an ab distension or an ab repair. A hernia is a hole in the muscle. It's just one little hole. An ab distension is where you have full separation. So usually they say if you take your fingers and you press down, it should all feel like one flat, nice tight line. If you push in there and you feel something squishy, like when you contract your abs and you feel a space or a dent or something squishy, then you may have ab distension. And that may be something you want to consult a surgeon about. Here's where things go wrong. You guys decide, oh, it's just fat, I'm going to go get lipo. You don't pick a surgeon who's going to look at you and go, oh, wait a minute, you might have a diastasis recti. You just go in and you're like, no, I just want lipo. Then you go get lipo and you see it even more because now you don't have fat sitting on top of that separation. So when they take away the fat, you see the separation more and you're like, oh my God. Of course, 6 months later after the swelling's gone, why do I still look like this? Because you have an ab distension. And the surgeon that you went to, whether you went to Miami or somewhere else, Sonobello, Elite, where it's just in and out plastic surgery, you tell them what you want, they do it, and that's it. They're not looking at you. They're not really touching you. They're not feeling you. They're not seeing what's going on with you. You're just kind of in and out. Then yeah, they're going to do that and then you're going to notice that you have a problem. So this is why it's super, super important. When you're going in for surgery and you're picking a surgeon, you want to go to someone who's going to actually look at you and feel you and see what's going on. Just because you have loose skin doesn't mean you're getting an ab repair. You may just have loose skin. Your abs may be completely fine. Your linea alba may be completely intact. You may not have a hernia or any ab distension, and you may just need a skin removal. Now, here's where it gets a little interesting. So the same cuts that you would make for a tummy tuck around the belly button and that nice low bikini line scar is the same cuts as a diastasis recti repair. So they do the same thing. They open you up and they go in there and they sew the abs together. They sew deep into the muscle. Now the sutures that they use, I have seen some doctors, most doctors use nylon, which are the non-dissolvable ones. I also know some doctors who use dissolvable. What is the difference? Depending on how bad your ab repair is. If you don't have any distension and they just do a little bit of ab tightening, then yeah, they may use, dissolvable sutures because it doesn't need to hold as strong. But if you have a serious separation in your abs, then they may use stronger sutures or permanent sutures. Here's where the healing time thing comes in. Whether you have dissolvable or regular sutures, it is still going to take 6 weeks to 6 months for that to heal. So that means no lifting anything heavy, no working out, no abs workouts, no crunches, nothing like that, because we want to make sure that heals as tight as possible. So the difference between an ab repair and a tummy tuck is an ab repair is internal muscles being sutured together to make them tighter, whereas a tummy tuck is just skin removal. Yes, they are done at the same time together most of the times because they're in there with the tummy tuck anyway, so they go in and do a little bit of ab tightening. Or if you're going in for the ab distension and you have a little extra skin, they'll tighten it up with the tummy tuck at the end. So just because you're having a tummy tuck does not mean you're having an ab repair. And just because you feel like you need lipo doesn't mean that's the solution. Find a trusted surgeon. Now that we've gotten that out of the way and we know what it is and why it's there, let's talk about healing. When you have a tummy tuck or even an ab repair with a tummy tuck or an hernia repair with a tummy tuck, it's still going to be a minimum of 6 weeks. Here's a couple things to look out for. If you are having an internal ab repair, they're going to put drains in because you're going to have blood that's going to need to come out. Most surgeons, 90% of surgeons are going to put drains in. So you're going to have the JP drain sticking out, which means you're going to be in a binder for the first maybe like 2 weeks. And then you're going to have the drain's going to come out, and then you're getting into a garment. My little tidbit of advice, you have internal sutures. Do not squeeze the living holy hell out of yourself in a garment or a binder. That binder should not be cutting the crap out of you. 1, the binder is going to cut right into your incision. 2, you have internal swelling from the ab repair on top of swelling on top of that, like on the outside interstitial space, on top of sutures internally that we cannot be crushing. So tighter is not better. To moderate your compression, use the Amare lipofoams, put them in your binder all the way around you 360 so you make sure you're not crushing the crap out of yourself and it gives you a buffer. Same thing in your faja or your garment, whatever you are using. Pop in the Amare lipofoams, stick them in there to cushion you so that those internal sutures are protected and that you're working on that swelling with those foams and you're not over compressing with your garment or your binder. That's the biggest problem that I see, is that you guys are so deathly afraid of popping a stitch in there or doing anything like that, that you're squeezing yourself into these garments, into this binder, thinking that it's going to do better when it's actually putting pressure on your internal sutures. So tighter is not better. Always. But yes, that's going to take about 6 weeks to 6 months to heal. That is up to your surgeon and how involved your ab repair was. Now, it is possible that you only have distension in one spot and the rest of your linea alba is completely intact. So that's going to be less of a recovery time. On the other end of things, if you've lost 300 pounds and you're doing, a body lift or a tummy tuck, yeah, it's going to be a little bit more involved. It's going to be a lot more intense. Those sutures are definitely going to be non-dissolvable sutures, and it's going to take you a little bit longer to heal because it was a more in-depth repair. So as far as healing times goes, it's anywhere from 6 weeks to 6 months. I have seen it take 6 months only because there was no proper MLD massages. There was no garment, which was beyond me. She wasn't in a garment at all. And there was no aftercare. No one told her how to take care of this at all. So she found me at 3 months. Hard, fibrotic, internal swelling, the whole mess. And we got her healed in about 2 months. And the tightness subsided. Now that's something else I want to talk about. The tightness. You should not, common sense, be stretching your ab repair, even at 3 months. Yes, it's tight. It's tight because it's meant to be tight. They're internal sutures holding your abs in. You're going to be hunched over for a little while. But with us, when you're doing proper manual lymphatic drainage, when you're having the proper foams in your garment, when you're using the proper garment, and you're doing the things you're supposed to post-op with us, generally by week 3, you're standing up straight. If you find me a week out or 2 weeks out after you get your drains out, by week 3, you're standing up straight, you're moving better, you're breathing better. What happens is after that 3-month mark, you've had so much fibrosis, everything's healed, and you still have swelling in there. And that swelling is pushing on those already contracted muscles, and you're not able to stand up straight or walk straight, and it's really tight to where you eat and you breathe and it's really uncomfortable, is because of all of that swelling putting pressure on your sutures, on your internal ab repair, on your stomach. So you can't move, you can't breathe, life is miserable. Getting your MLD massages as soon as you can after surgery is what helps you stand up straight after a tummy tuck or an ab repair. Because as we're getting that fluid to drain out of your abdomen, you have more room to breathe. You have more room to move. You're a lot more mobile because there's no pressure in there. So MLD massages, the lipofoams, your garment. Those are the 3 major things you need to be on top of, as well as not having salt and drinking enough water. That's always, no matter what surgery you do. Those are the things you need to be on top of with an internal ab repair. Obviously, no lifting anything heavy, no doing any exercise until about 3 months, all of those things as well. But yes, you're supposed to be a little bit contracted, but hunched over to the point where you can't get up out of a chair, or hunched over to the point where you can't take a deep breath and it's 3 months out. You've got compacted swelling, you've got fibrosis, and the garment's doing something to you that it shouldn't be doing. So yes, there is that little bit of time where your abs are healing and we don't want to pull on it. Like I said, that 6-week mark. But if you're out to 3 months and it's still that bad as if it was like day 1 or day 2 out of surgery, you got to do something about your aftercare. It's not supposed to be like that. Yes, those muscles need time to heal. Yes, you're going to be tight, but it shouldn't be that tight where it's like bloody murder for 3 months. So there's that little part of it with the healing. Also, with the healing, you guys need to make sure you have a comfortable place to sleep. So in a recliner or supported up on the bed, you're not going to be laying flat for a while. Keeping your knees bent 24/7 when you're in the recliner or when you're laying back. We want no pressure on that to make sure nothing in there rips. Now, this is one more thing I want to address. I love you guys, but you freak out for like everything. You freak out. If you feel pulling is normal. Because again, everything in there is tight. If you feel ripping, burning, popping, searing pain, that is pulling something. That is like pulling on your incisions, and that is like popping a stitch. People are so worried about popping a stitch, right? The most common stitches that pop are not internal. They're the external ones. From the abuse of your binder, from not wearing the foams, and the binder cutting directly into your incision. From you trying to stretch because you feel tight instead of getting your massages. From you having too much salt or wearing a garment that's way too tight, compacting all of that lymph fluid, causing fibrosis and tightness right behind your tummy tuck incision. Or the dreaded squeeze massages that try to push fluid out of your incisions directly where your tummy tuck is and create a giant bubble of swelling right over your tummy tuck incision or right where your drain was, and then you freak out and think you have a seroma. It's not a seroma. It's the squeeze massage person not being licensed or knowing what they're doing and pushing lymphatic fluid and pushing swelling right behind your tummy tuck incision, and now you've got a giant bag of swelling, which we can easily get rid of if we're doing the right things, if we're using the foams, if we're drinking the water, if you're coming in to get your sessions done. So the quickest that I've seen with an internal ab repair and a tummy tuck, healed out of the garment, completely healed, not even an inch of swelling on her, incision healed, scar healed, everything, 5 weeks. She came to me post-op, before surgery. We got her in an Amare garment, we got her with the foams, we got her on the wound care. I explained everything to her, and she was in a week after surgery, consecutive days back to back, for her lymphatic drainage, Monday through Friday for 2 to 3 weeks. And she was done by 5 weeks. No garment, laying down flat, completely fine. She even got clearance from her doctor to stop wearing her garment. She got clearance from her doctor that she's completely healed at 5 weeks because she did all of the things pre-op to get set up for her ab repair and tummy tuck, and she stuck to the protocol from day 1, and she got all her massages done, and that was it. So it is possible to be done at 6 weeks with your tummy tuck and your ab repair, especially your ab repair. It is completely possible to be completely healed and done and out of the garment and no drain, no incisions, no pain, nothing like that at 5 weeks. If you are super on top of it, even with the internal stitches. But again, you guys don't know any of this, and you don't do any of these things, and you don't schedule with a specialist like myself to get prepared beforehand, and we wind up floundering afterwards. So just to recap a little bit, internal ab repair does not mean tummy tuck. Internal ab repair means sewing your muscles together internally to close the gap between your abs so that your organs and your diaphragm and everything isn't popping out anymore, causing a pooch or causing GI problems or causing breathing problems or causing any of that stuff. It is more of a medical technique than a plastic surgery technique. It is recommended that you get a plastic surgeon to do your ab repair because the scar that you have is the same scar as a tummy tuck scar. And a lot of times, even if you don't have a lot of skin and you're super fit and you have this distension, or maybe you do have a little bit of skin from being pregnant, it's better to have a plastic surgeon do it. The scar will come out better. The work will be cleaner than just going in and having a regular surgeon do it. The healing time, 6 weeks to 6 months, depending on how intense you're taking your aftercare and how serious you're planning to be with your aftercare. Stitches can be dissolvable, which I have seen, or most of the times they're not. They're nylon, they're regular stitches, and they are in the muscle. You don't feel them. Abdistension and hernia are two different things. Abdistension is a separation of the muscles where the linea alba is thin or destroyed. A hernia is an actual little hole in the muscle. Totally different repair techniques, and I will do one on hernias later. Healing time, recovery, garment, don't squeeze yourself into it. It shouldn't be that tight. Binder should not be that tight. Yes, you're more than likely going to have drains after a ab repair. And that's pretty much it. I think that sums it up. So this is a little bit of information on that for you guys. I will do another video on the hernia repairs. You guys that are on Spotify, to see the pictures of what I was talking about, head over to our YouTube and search, I guess, abdistension is what I'll put this under. And that's it. If you guys have questions about abdistension, if you had a tummy tuck or a hernia repair and you need help healing from it, please call the office. Do not DM us, 732-841-0142. Alex will be happy to set you up with a virtual consult with me. And that's it, guys. I will see you next week. Bye.